Hello and welcome to the Microlearning series presented by the Refugee Health Program at the Minnesota Department of Health. This series is meant to help providers, clinical teams, and public health better understand the best practices for refugee health screening. This video focuses on sexually transmitted infections and pregnancy screening guidance during refugee health assessments. All arrivals of reproductive age should be screened for STIs and pregnancy, if applicable. Providers should use their own discretion to also screen individuals in cases of sexual abuse, congenital syphilis, or other circumstances that might warrant screening. Urine pregnancy tests should be performed for all women of childbearing age and pubescent adolescent girls. Family planning and available contraceptive methods, including accessibility, efficacy, and cost, should also be discussed. Arrivals 15 and older should be tested for syphilis unless there is a documented history of recent syphilis diagnosis and treatment overseas. Female arrivals younger than 25 years of age who are sexually active and do not have a documented pre-departure testing for chlamydia and gonorrhea should be screened for those STIs. Additional STI screening should be performed as indicated if an arrival is symptomatic. STI and pregnancy screening should occur during the initial refugee health screening, and any findings should receive appropriate follow-up. Urine pregnancy tests should be repeated if the last unprotected intercourse was in the last 14 days and the patient has had no menses. Make sure there's a plan for ongoing access to contraception if desired. This guidance does not reflect any major changes in recommendations. However, there is more explicit guidance regarding pregnancy testing as well as testing for chlamydia and gonorrhea. Minnesota recommends redrawing syphilis tests for those with negative results overseas. And Minnesota also has state-specific resources that are linked in the next few slides. As part of the paperwork for the refugee health assessment that is submitted to the Refugee Health Program, there is a section where STI and pregnancy screening results can be recorded. Note that the pregnancy results section can be found under the Other Health Conditions section, and there you will also find a section to record breastfeeding status. Please make sure this section is being filled out appropriately. If you're interested in learning more, please look at the full screening guidance and other resources outlined in this page. The well-being of all Minnesotans, including those with refugee status, depends on the work and dedication of our partners. Thank you so much for your work.